Hi everyone, welcome. I'm Jacqui. I'm health coach and physiotherapist at Lotus Holistic Medicine. Lovely to have you with us tonight. We realise it's state of origin, so big commitment from you guys. Thank you for showing up. So tonight we are going to chat a little bit about how things work at Lotus Holistic Medicine. So what our approach is, the different things that we combine and the sort of results that we get at the end. So I hope it's informative for you. We've got a Q&A button down the bottom there. So if you've got any questions, feel free to jump into there and type in your questions. We may be able to get to some through the presentation. Otherwise, we will leave some time at the end to be able to answer those as well.
Okay. Well, a little yak about me. I just came off another webinar and I was just telling everyone about my journey. But basically, I was a conventional doctor in all senses of the word for the first 5 years or so of my career. Then I had a little brush with illness, which included taking a very high dose of or a very strong antibiotic when I was traveling in America, and then experiencing very, very severe headaches and fatigue and mood disorders. And luckily, I was able to recover very quickly, mainly just through internet research. And really where that led me was understanding that there's a balance in the body and in the microbiome, and that really just a disease-oriented model was probably not enough to achieve lasting health for most of us. So I then subsequently had mold illness, tick-borne disease, mercury toxicity, adrenal fatigue. So I guess you could say these last 10, 15 years I've had a very practical education from the universe into how health problems work. And so we'll talk a bit more about that as we go along, but that's kind of where Lotus Holistic Medicine evolved from.
So I'm Jacqui, as I mentioned before. So I was a very conventional physiotherapist working in the hospital system for a number of years. I also, after my first daughter was born, I went on a little bit of a holistic health journey. I had a number of health issues myself, gut issues, thyroid issues. I was very stressed out as well, and I knew that something needed to change. And so I started changing my own health, my own diet, my own lifestyle. Did a lot of work on my nervous system as well, and realized that my health conditions had all disappeared from the changes that I had made, which was powerful for me. And then went on to wanting to incorporate these things that I'd learned on a career level to be able to help my clients as well. I knew there was a lot more that I could be doing from them outside of neuro rehab, physiotherapy perspective. And so I went on to study health coaching, low tox coaching, and now combine all of those things together. And I have become very interested in nervous system regulation and how that works. And it's a big part of what I do now as well.
Okay, you want to do this one, Jacqui?
Yeah, I can. So today's webinar, we'll go through our holistic approach, and Sandeep's already mentioned a little bit about how it came about through his own health journey, but how he brought that then into the structure that we have now. So we have 5 pillars that we work on with most people, most clients that come into the clinic. So 5 pillars of health, and we'll go through them in a little bit more detail as well. We will look at a case study, so how we implemented this process with one of our clients and the results that person got. We've got the lovely Emma with us tonight as well, she was one of our first patients who started with us on the monthly program. And so she is going to chat to us a little bit about her experience and what she found useful about the structure that we have within the monthly programs. And then we'll talk a little bit more in detail as well about the monthly programs, how we've set them up, and also why we've set them up in the way that we have.
Great. So just expanding a little bit about what I talked about before. So initially my own health journey started with this dysbiosis, if you like, where just taking an antibiotic seemed to change my health forever. And what I discovered was that not only had I changed the biome, which means the different organisms in my gut, but also by developing leaky gut, that had then allowed foreign proteins to get into my bloodstream, which were then responsible for causing headaches. And a really amazing aha experience I had on my health journey was realizing I could turn off my headaches by taking the supplement glutamine. So at one point, I could literally turn my headaches off like within 1 minute by taking a certain amount of glutamine. It was quite a high dose. And like I could take them away down to 0 out of 10 all of a sudden, and then they'd start creeping back again. And then I could take more, and the same thing would happen. So just realizing that, hang on, there is some very definite principles at play here that relate to the gut. You know, this isn't theoretical. In those cases, it was very, very definite and practical, like just taking that glutamine or doing other different practices all of a sudden would just get rid of my headaches all of a sudden. So I realized that, you know, that basically the way in which we've separated the different systems in modern medicine is quite artificial, because usually you would say, oh yeah, no, you just go to a neurologist if you've got a headache problem. You would never consider going to a gastroenterologist. But actually, the problem was actually very clearly from the gut. It wasn't originating from the nervous system. And so that's just one example in understanding how different organ systems are actually very, very directly connected. So in this case, the leaky gut would directly cause a neurological problem. Another example would be it could just as easily cause fast heart rates or chest discomfort. So that would be an example of a gut impacting the heart. So I guess that was one way in which I started to understand that a more holistic approach was needed, rather than segregating the organ systems into totally separate compartments. Really, in many cases of illness, it was much more helpful to think about the body as a whole and what was impacting on all the different organ systems. So my next little lesson so that was around 2005. My next little lesson from the universe was in around 2011, when I had a home on the Sunshine Coast flood. Now, my partner at the time was extremely unwell and actually became bedbound. And I really couldn't understand what had happened to her based on my training to date. And so that led me to just go ahead and just instantly sign up to a physician certification in mold illness. And through doing that, it gave me another perspective on how the delicate balance of the body could be thrown out by an environmental cause. Something as seemingly minor as mold, which probably most of us think is everywhere and is just, you know, a part of life. But in fact, mold exposure can be a massive trigger for chronic illness in many people, and I came to realize that. And then when Dr. Klinghardt came to town in 2017, came to Sydney. So he's a integrative doctor originally from Germany, but now in Seattle in the United States. He came over and did a training on his system, which he calls autonomic response testing. Now, during that training, I found out that I actually had some tick-borne infections, and I was not aware of that. And so Bartonella was a big one. And that was another explanation for the headaches I'd been getting, and also various other symptoms. So it was almost like the more and more I dug, the more and more I found. And then at one point, so I think I've done around 20, 25 hair analyses myself. That was another little area I trained in. At one point in my health journey, I had a massive dump of mercury. And so initially, there wasn't any mercury or any heavy metals at all showing up on my hair analysis. But once I underwent certain protocols, all of a sudden I came to realize I've actually got a massive amount of mercury in the body. And temporarily, while that was all coming out, I started to feel very low in my moods. And again, I was sitting at a Dr. Klinghardt webinar, and he started saying, well, the key is if you're mobilizing these metals, you will actually feel temporarily worse. So then you have to bind them. So I literally, like, in that moment, I just started guzzling Chlorella tablets. And it was like, again, just like the glutamine story, it was within 1 or 2 minutes, I just started feeling like, oh, no, I'm normal, I'm fine. All of a sudden, I was able to pull that mercury from the bloodstream into the gut and out, and all of a sudden I started feeling okay again, not so low and depleted as I had. So very interesting little journey. And then along the way, I'd found that I had various different nutritional deficiencies. I was very low in B12 to start with, and vitamin D, and just understanding how I could support my system with various types of nutrients has also played played a part in how I now deal with clients on their recovery from chronic illness. So I guess I'd say, before I jump into this part, I think there needs to be a good balance between practical experience and theory in order to have a really successful program for chronic illness. Now, I think the problem, if you just come from practice, is sometimes there is a tendency to start seeing everything and everyone as having the same things that you have. And of course, you never want to get that, narrow-minded. So you can, sometimes you see in the integrative medicine movement that, certain practitioners are like, oh, everything's thyroid, or everything's mercury, or everything's mold. And we never want to get that short-sighted. However, if you just come from a theoretical basis in medicine, what I've realized is that tends to miss a lot of the more subtle interplays between many of these factors like gut health and stealth infections and environmental factors. So I think that's just one point I wanted to make, is having both sides seems to help to come up with this program, this Lotus Holistic Medicine program, which I believe is very, very useful for chronic illness recovery. Do you want to talk a little bit about the pillars, Jacqui?
Yeah, sure. Have we got individual slides for them after this?
Yeah. Do you want to jump into that?
Yeah, we may as well. So pillar 1, so we do talk a lot about diet. So it is really important to have a solid diet when you're trying to heal from a chronic condition. So from multiple different perspectives. So we want to try and reduce the inflammation in the body. We want to use food as medicine in a way. So we need to make sure that we're feeding our body with as many sort of vitamins and minerals as possible, so that we can actually heal and we really assist the body to heal. So our diet is nothing crazy. It's really just trying to promote an anti-inflammatory sort of diet. So we try to cut out sugar, try to eat whole foods, so we're not taking in extra toxins. So the preservatives and additives and things in food is another thing that the body then has to try and detox. So ideally we're not taking them in. And then depending on your particular case, we might remove some of the carbs or ask you to reduce some of the carbs that you're eating as well. But that's, depends on the individual. And then at another level, we also do what's called metabolic typing. So when you come to start with us, there's a questionnaire that you'll go through. And the questionnaire is asking you lots and lots and lots of different questions about how you feel after different foods that you eat and various things. And it spits out a score at the end that will tell us whether you are a protein type all the way up to being a veggie type and anywhere in between. And then we're able to tailor your diet a little bit more specifically for you as to how much protein you should be having versus the other macronutrients. Did you want to add anything to that, Sandeep?
Yeah, I think one way of thinking about it is when you're building a house, or when, let's say, a house is in disrepair, One way you could look at it is, well, let's just put a fresh coat of paint on it and hope for the best. Or you could take the approach of, let's start from the foundations of this building. If this building is falling apart, we need to make sure there's a really, really solid foundation. And so, in my view, the diet is the one of the most basic foundations. I guess I would say your thoughts and emotions are probably the other part of the foundation. And so just getting those very basic pillars of the building as solid as possible is going to be a good strategy for then having a strong and healthy building. So it is absolutely critical to get the diet piece right. I can jump into this if you like. So the pillar 2 is around supplementation. Now, that can be oral or it can be injected. Now, the purpose of it is to strengthen up certain weak points in the body. So in the case of me and my depleted gut, I would be then supplementing the substances which are going to assist me to push my system back to a state of health as it relates to gut health. So it may then include, we talked about glutamine, so it may be a glutamine-containing formula for leaky gut. It was probably most likely going to include prebiotics and probiotics. In those days, I didn't actually know about prebiotics, so I was just taking probiotics. But then there may also be there may be anti-inflammatory supplements or nutraceuticals, and there may be nutrients to correct the nutritional deficiencies. So things like vitamin B12 and vitamin D and iodine and zinc. These are some of the really, really common nutritional deficiencies that are seen every day. So the purpose is really just to bring strength into those areas in which there is currently not strength. Again, going back to the building analogy, because if you've got certain pillars of the building falling apart, again, that's not going to be conducive to a healthy and strong building. So once we've got the foundation right, then strengthening up all of the different arms of the building, I guess you could say, is the next step.
Detoxification is pillar number 3. So there's a few different methods of detoxification. Detoxification is really important, especially if we're trying to draw out things like mold or heavy metals. We don't want that to then be recirculating through the body. We need to be excreting that out. So it is a really important part of the program to make sure that your detoxification pathways are open.
Yeah, so one other way of describing it is to assist an overloaded system to regain balance. And a common phrase that people often hear is that, well, hang on, your body is designed to detoxify already, so what are you talking about? And I definitely agree that that's true, but the issue is the detoxification pathways of the body do become overloaded, and that's very common, especially in a situation where there's been a lot of environmental toxins. So let's say in my case, I had to do a tremendous amount of detoxification in order to get my organs functioning really well, like particularly liver and the gut and the brain. And so the purpose is to bring the system back to balance. Now, after some time of really focusing heavily on detoxification, you may find that the amount of detoxification procedures that you need to perform is far less, because you've essentially already relieved the system of the overload to a large degree. So it is a real key, detoxification. Again, you could say, with the building analogy, you're basically getting rid of anything that's eating away at the foundations of the building. Jump into this one. So then the home environment, the purpose of this is to identify if there are factors in the home or work environment which are triggering inflammation. So in the case of my partner who is bedbound, she may be eating a fantastic diet and getting all the emotional side of things right, but essentially something in the home environment is just overriding everything else and causing her health to be very poor. So in that case, the absolute key at that point is to identify what it is in the home environment that is causing the problems, and to eliminate that. And so it can be chemicals, it can be mold, it can be EMF. Sometimes, rarely, there are other factors there that can be causing problems, but those would be some of the really key ones. And it's just, again, you're just identifying things that are getting in the way of the foundations of your building, holding the building together, if you like. So home environment's very, very key, and getting that right. So, for some people, just even something as simple as wireless internet could be causing so much inflammation for them that it could be leading to poor health outcomes, while everything else is reasonably good. So it is very, very important. The points on that? Okay. Want to do this one?
Oh, it did change, sorry, yeah. So the last pillar we talk about is nervous system and emotions. And what we find with this is that people with complex chronic illness tend to have a dysregulated nervous system. And what that leads to is it means it's much more difficult to heal. It's much more difficult to detoxify. It means our digestion isn't working properly. It means that we're not absorbing nutrients. The inflammation can increase. We have changes in our immune system. And there's just lots of different things that will happen within the body when our nervous system is dysregulated that makes it harder for us to get better. So one of those processes is involving the brain. And so you might have heard of the limbic system before, and also the amygdala. So that's that picture on the right there. So the amygdala is like the fire alarm system of our body. And so its job is to always detect whether we are safe or whether we're not safe. So it's constantly asking that question. And it's getting the information both internally, so from the messages from the body, but it's also getting that information from externally, from our five senses. And if the amygdala decides that there's something that's not safe, it will then set off a response to that to try to keep the body safe. So, for example, in the case of environmental toxins, initially the body will realize that there's some mold or there's something in it that it is dangerous to the body, and it will mount a response. Over time, what happens though is the response becomes higher than what the trigger is, because the body becomes quite good at recognizing these things. And so it becomes efficient, and because it's trying to protect you, it then starts to react more and more to the same amount of response to stimulus. So eventually you get this kind of big mismatch between what's kind of going on in the body and what the brain is saying. So the brain is really saying there's lots and lots of danger. And it's right. It's done it in the past because it's trying to protect us. It's just that response becomes a little bit overactive. And so a big part of what needs to happen there is some brain retraining so that the response from the amygdala is appropriate to what's going on in the body. And so when we're in this sort of state, we'll often be stuck in a fight or flight state. So that picture on the left is showing some different states there. So one is rest and digest. So that's where we want to be spending kind of most of our time. And we've then got the sympathetic activation, which is fight or flight. And so when we're in fight or flight, our body is primed to run or to flee. The blood supply is going out to the periphery rather than in the body where it needs to be. And so we don't get those healing functions that I was speaking about before. And then there's also this other state called shutdown. So when the body has decided that fight or flight is no longer enough to keep us safe, it can flip into that sort of shutdown state where you'll feel completely exhausted, like nothing's going right, almost a state of despair, I guess. So that's something that we do a lot of work on in coaching sessions as well.
Okay, so we thought we'd go over a case in order to illustrate this. Some reason the photo hasn't presented, but oh well. Just imagine a picture of a 48-year-old female. So the presentation of the client was that she had nausea, anxiety, fatigue, brain fog, memory problems, headaches. She was quick to anger, pains on the soles of her feet, skin rashes, has become very sensitive to chemicals or other substances, and this started after exposure to mold from a water leak in the home. So one of the things I'd say to start with is that, it has symptoms from many, many different body systems. So it's not just one body system. It's the gut, it's the brain, it's musculoskeletal. So it's what you call a multi-system illness. And many doctors do get overwhelmed with this kind of presentation because they tend to think that you can't get so many systems being affected by something, and therefore it must be depression. So that is quite a common perception. But it's important to realize that inflammation due to environmental toxins can give that kind of presentation where there's just so many different symptoms in so many different bodily systems. So the testing we did was serum mycotoxin testing, and as you can see on the right-hand side here, many of the mycotoxins were in this extremely high category, or around 5 were, and around 1, 2, 3, 4, 5, 6, 7, 8 were in the moderately high category, and then a few were just in this mildly high category, which is the yellow, or mildly to moderately. So there's really a massive immune response to mycotoxins. And although blood and urine testing for mast cell activation syndrome was negative, there was a positive response to mast cell stabilizers. So that's an interesting point, actually, that this condition of mast cell activation, it's actually very common. The testing in Australia is probably insufficient to be able to identify that on a regular basis. So for many people, it will just be a trial of treatment, and just suspicion that they've got it, which is going to lead to identifying and treating it. So then the third thing was that ARRL testing, which is a specialized lab in Geelong and Victoria, showed a positive Bartonella IgM serology and a positive Rickettsia IgG. So these are two different types of tick-borne infection, which can also cause a range of symptoms. So when we mentioned that the patient was quick to anger and had pains on the soles of the feet, those symptoms are quite classic of Bartonella infection. And then we found that she had an elevated homocysteine and low normal zinc, iodine, and vitamin D. So the original formulation was mold illness, possible tick-borne illness, and mast cell activation syndrome. So what was our approach? So one of the things, this patient was part of our monthly program. So one of the things was working with Jacqui or one of our health coaches to basically improve their diet and get that foundation working really well. And so patient was a protein type in terms of their metabolic type. And so For those people, it's really important to just ensure there's a really good source of protein and fat with each meal. And you never have any meals that are just sort of purely carbohydrate, like cereal or those other crazy things that we used to eat when we were growing up. And so in terms of supplementation, initially all we used were mast cell stabilizers and antihistamines. Now, the reason for this is often clients who have had a lot of mold exposure and have been unwell for some time, they're in what you call a cell danger response. And therefore, if all of a sudden we try and kill off some of these tick-borne infections or go really hard at detoxifying the mold, that's actually going to trigger more of a cell danger response, and it's going to trigger the amygdala that Jacqui talked about. It's going to trigger the mast cells as well, and often the person would actually feel worse rather than better. So our protocol often involves settling down this hyperreactivity of the mast cell as one of the first interventions, and then nervous system working with the health coach as well as an online program allowed her to basically start getting some exercises in place where she could just continue to reassure herself that she wasn't in any danger. Although there had been a danger initially, that danger is no longer present, and rather she could just relax into the present moment and let go of this danger response from the limbic system of the brain. Then the fourth thing we did was making sure she had a thorough assessment with the building biologist of the house. And that's before using any kind of medications or supplements for mold-related illness, just to identify what was actually going on. And that building biologist, did identify major mold problems, which helped her to be more definite about the fact that her home was contributing to her symptoms. So as she went along, her course was up and down, and we often do find this with regard to mold illness, that it's not a straight path towards recovery, unfortunately. We all wish it would be, but there tends to be some ups and downs along the way, and she had found that she had various mold exposures on moving to various rentals. However, as a result of doing the nervous system work and the mast cell work, she was able to layer in binders and herbal tinctures for mold exposures, and then subsequently herbal formulas for tick-borne infections, such as the Bartonella. And through the nervous system and mast cell work, she became less sensitive and was able to find a residence, finally, that was relatively mold-free for her family. And that also allowed her to have a sense of more safety in the system, which allowed more sustained healing to occur in her case. So there's a whole bunch of things that needed to happen in her case in order for her to move towards wellness on a more sustained basis. So despite her improvements in all most symptoms, she continued to be fatigued, however, and unable to exercise beyond a brief dog walk every day. She was still concerned about her future and whether she'd have more further medical problems once she went through menopause and got into her 60s and beyond, which is probably is a fair concern to have after you've been through a chronic illness, because often, even after you've recovered, there may still be some imbalances in the system. So, for instance, the hormones may still be imbalanced. There may still be some toxicity problems going on. And so at that point, our recommendation was for her to join our longevity program and work on her general health and lifespan into her 60s and 70s. So one of the things is we try and identify with people, what do they want their older years to look like? And so she stated a wish to be active and healthy at age 80, with the ability to still go on regular bushwalks and overseas trips. So we estimated that she would need to be at a biological age of 65 at age 80. Now, her biological aging testing showed that she actually had a biological age very close to her actual age of 48. And she had low NAD levels, which is one of the things we check for, which is a substance which is very much related to cellular health. And she also had hormone imbalances going on and heavy metal toxicity. And one of the reasons for that can be that as a result of having mold illness for so long, that it actually blocked up her detoxification pathways, and therefore she wasn't able to detoxify normal heavy metals that she was encountering in daily life. So there was actually quite a bit of ongoing housekeeping work, you could say, to do on her health. So if you think about it, if someone's around about biological age of 50, at age 50, well, in order to reach this, they actually have to age only 15 years in the next 30 years. So biologically age. So that means that really she would have to dedicate herself quite seriously to longevity work, because we actually want her to only be aging at one biological year every other year, if that makes sense. So there is a very definite science to this, if you like. So in order to get to that, that state of having a much younger biological age than her chronological age, she was going to need to really dedicate herself to this. And so, well, before we jump on to Emma, the end of the story is she was able to make a lot of progress, and even though she went on and off the longevity program, overall she felt that there had been very significant benefits. So that's our case. So at this point, we were going to hand over to Emma. Did you want to introduce this little segment, Jacqui?
Yep. Just trying to bring Emma's camera on.
Sure.
I don't think I can do it. Sorry. So we've got Emma. We're going to have Emma chat to us tonight. So she was one of our first clients in the monthly programs. And so we just thought it might be useful for Emma to jump on and tell us a little bit about her story and what she experienced, and how she found the program overall, what she found the most beneficial. Here she is. Hi, Emma. How are you going?
Well, thanks. How are you, Jacqui?
Yeah, good. Thank you. Did you want to jump in and share a little bit about your story?
Sure, I can. So my name's Emma. I'm currently 51 years old. I'm a mother of 3 living in Brisbane. I started the program with Lotus in early 2023 after a fairly long journey, I guess, with up and down health. I probably first encountered poor health in my late teens, although probably through a lot of my childhood it hadn't been great either. But in my late teens, I really did go downhill quite a bit and experienced a lot of what my major symptom has always been, which is nausea. But that passed, life went on, and then my 40s hit. And when I reached my 40s, I really did start to go downhill quite significantly. And probably in around about 2018 is when it really started to hit rock bottom. And then in 2019, it was shocking, and 2020 even worse. So as I say, my major symptom was nausea. And if I had to pinpoint a trigger, I would have said it was in late 2019 when I was doing some painting. It was kind of an exposure, a chemical exposure, I guess you could call it. And that really did seem to tip me over the edge. And I ended up with symptoms like a chesty cough, and was given Puffer by the doctor. But, essentially it was just Band-Aid and it did nothing. So moving into 2020 and onwards, I had quite some major trauma in my life. And it was just an absolute downhill spiral. And I got to a point in mid-2020 where I was probably spending more time in bed than I was spending out of bed. And I could I couldn't even think straight. The whole world kind of stopped around me, and I couldn't understand how I'd been this mother who'd managed to run a family and hold down a job to this person who could barely get themselves breakfast. So I had various different doctors and physicians here in Brisbane that helped me yes and no, until I came across someone one day who did mention mast cell activation. And that's when I started looking, and that's when I found Lotus. And so eventually when I appeared on the doorstep in early 2023, I guess I had done a bit of work on my diet, and not so much my way of living perhaps, but definitely some work on my diet. But I needed some help going deeper and finding more and understanding why. And that's when these guys came on board, and I really haven't looked back. So I went from that person to the complete opposite of regaining my life back and more, I would say. And also, I guess, the support and the team of people around you to help you through that, what is essentially a very difficult journey at times. And, well, they become your new little family, and that's lovely. So it's daunting at times. It was daunting, that 2 year on the package at times, when, you're thinking, oh, I'm getting to this point, I'll be able to cut back on supplements and this and that. And then all of a sudden you're taking more. But at some point in time, it all just falls into place and it all becomes your new normal, and life's much better. So that's kind of me in a nutshell.
Thanks, Emma. Was there anything in particular you found most useful about the program?
I think I really like the word team within it. And team doesn't only go for the fact that you've got a doctor and a health coach. It's what can I say? It's a team of other modalities as well. So rather than just, looking at blood tests and thinking, oh, well, I'm going to slap this on it, there's a lot more explanation, so that, there's a lot more to that teamwork than just a diagnosis. It's the whole round package to help you get to where you need to get to. I haven't been the best with doing the detoxification pathways, that's for sure. But for me, the nervous system retraining, brain retraining side has been very, very good. And the understanding of myself and the ability to allow myself the space for me. Whereas I think when you're a parent, that kind of goes by the wayside. You don't have so much time. And so I like to say with joy in some ways that I've become more selfish about myself in this progress. But that's allowed me to be a better version of myself and a healthier version of myself.
Yeah, amazing. I love that end, Emma. It was great. Did you have anything you wanted to add there, Sandeep?
Yeah, I was just going to ask, how have you found the community support, like the other participants and so on the Facebook group and the webinars, and what's that experience been like for you?
Yeah, well, that comes into the team as well, and it helps you feel like you're not completely alone on that journey. When you hear other people's stories, you think, oh yeah, well, that's me as well. So, because it is lonely when you're unwell like that, especially when you've been faced with other practitioners who say, oh, well, it's all good, just take this and go home and you'll feel better. But you don't. You feel like you're the only person out there that you're sort of a bit crazy. But that group, there's a group healing to it. That's absolutely for sure. There's a group healing to it. And I think that a continuation of that is very important. And also when you get to a point where you have been on the journey for long enough that you can also offer feedback and assistance to others, because you remember what it was like to be like that. It's actually, if you go back and you look at perhaps some notes you've written down about your health, you wonder who that person is. And so when I see people saying, oh, this is overwhelming, well, yeah, it is overwhelming. But if someone can put their hand on your shoulder and say, don't worry, I was there too, you will get through this. How about trying this, or how about doing that? At some point in time, this will all just be normal to you. It's a huge help. It's a huge help.
Yeah, great. Yeah. I can't think of anything else.
I think everyone who comes into the programs, there's a number of things in common, and you've touched on a lot of them there, Emma. I think most people have tried a number of other things and feel quite unheard often in terms of what they've been through and unseen. And as you said, have been told, take this and you're fine. There's nothing wrong with you. And then, there's a lot of ups and downs as well. It's not a straight path into healing. And I think all of those things make the group a really powerful place for people to come together and support each other through those challenges.
Yeah. Well, I mean, you always hear the saying, healing is not linear, and it absolutely is not. And, there'll be times when I won't be feeling so great. And I think, oh, surely I'm not going back there. But I also found that, deeper you get into that healing journey, the more you have, you have the agency to be able to withstand more. Like rather than before, you might have had, gone downhill for 3 days with a reaction to something. That might become only a couple of hours. It might be next to nothing at all. And it really... You gain strength. You gain strength along the way.
Yeah, absolutely. Well said.
Well, thank you for that, Emma.
It's a pleasure.
A great little testimonial.
Thank you guys for being there for me.
It's great to have you with us.
Pleasure. Now, Emma's like a group expert on our Facebook group and posts all kinds of interesting stuff.
Yeah, some nice food choices on there. I like the recipes.
Well, I mean, it's nice to be excited about food again. At one point in time, a couple of years back, I thought, am I ever going to like this stuff again? I'd built up such almost an anxiety around it, because so you feel that's what's driving the nausea when it actually really isn't. But that's just what your brain's telling you. And so you had to learn to fall in love with food again. And there's so much pleasure to be had in that, It's beautiful stuff.
You appreciate it more when you come back around to it, hey?
You do.
Yeah.
Wonderful. Okay, great, Emma. Thanks so much.
Pleasure.
All righty. So I guess just to explain a little bit more about the monthly program that Emma was part of and that we offer for people that are unwell. These are our integrative health programs. So looks a little bit overwhelming, but the key thing is, the foundation of it is you've got doctor consults and health coaching. And community support, and then some other freebies if you like. So if you have a look, the different so we've got rose, gold, and diamond, and so if you have a look, so basically the price goes up and the offerings goes up. So a lot of people, our main program is the gold one, and so maybe focusing on that. So what happens is the initial doctor consult's around 1 hour, 40 minutes. It's quite long. After the 20-minute testing consult, and then you get an additional hour visit with the doctor. And but you get a lot of health coaching on this one. So there's actually 6 health coaching consults over the 6 months. So because we really feel that a lot of this is actually about lifestyle, and a lot of it's about the nervous system and just getting your daily habits right. Well, what I actually found at one point was that I would give people a treatment plan, and they would come back quite often and say, well, look, I haven't really been able to do it. And a lot of the time, and I realized, well, hang on, coming back to me is probably not really the way to go here. Because what's the point of me giving you another treatment plan if you haven't followed the previous one? Really, you actually need someone to to basically help you with achieving it. And so really, we started doing health coaching, I think 5 years ago or something like that. And our main nurse, Shireen, started doing this with people, even though she's not specifically educated as a health coach. But after those initial experiences and realizing that people get much better results, that's when we actually hired specific health coaches. It was initially Anna and then Jacqui. And so what we've realized is, as a clinic, this is our direction that we want to go in, is that we want all clients to be involved in educating themselves and working on their lifestyle, not just getting a plan from the doctor and if you like, leaning on the doctor to a large degree, which may not be intentional, but it does happen. Really, what we want is for people to be doing the health coaching, and then the other part of this is there's online courses. So if you do the Rose package, you get the EMFs Made Simple course and the Mold Illness Made Simple course. If you do the Gold package, you can do those ones, or you've got the option of doing Primal Trust for 3 months, which is a online nervous system retraining program. So that for many people, they find that to be very, very powerful. The Mold Illness Made Simple and EMS Made Simple is more about getting that knowledge of what are some of the main things you need to do to recover. Like, for instance, just finding a mold-free residence and trying to get away from having Wi-Fi and Bluetooth all around you 24 hours a day. But the Primal Trust is all about learning exercises to start getting out of that cell danger response and starting getting into the present moment. So if you do the Diamond, you get all of the courses. So if you want to be a course junkie, you can. There's also some tests included. Well, not with the Rose, but with the Gold package. There's a new test we've started using for patients suffering from mold, which is called ALA-TEST. And it's an American test looking at IgG antibodies to 15 different molds. So we give that one in the Gold package, or you can do some gut tests instead, which is what we call intestinal permeability and secretory IgA. However, if you're doing the Diamond, you get basically, there's another level where you can do the MyMycoLab testing, which is actually that one, basically I showed in the case there, which is looking at a very large number of mycotoxins and the antibodies to those. Or you can do the Dutch hormone test, or you can do the organic acid test, and that's all included. And then so everyone then gets a bonus webinar. So this is our general monthly webinar for anyone who wants to come along. But then we also have a bonus webinar. So that actually took place just prior to this one. Usually both Jacqui and I are there. Today it was just Jacqui. But we usually talk on a different topic. I believe Jacqui covered detox today. And then open the floor for comments and questions. And that's where some of that community bonding comes in. Sometimes people are like, well, hang on, I've got that. I can help you with that. I can give you some links. And so people sometimes get in touch with each other and become friends and so on. So that's a nice little community part of it. And so there's some discounts on supplements and IV nutrients. And there's a Facebook group. And the Facebook group's actually quite active now. So, sometimes it's just a matter of having a discussion on a different point. So one of the latest ones was, how's everyone getting their exercise at the moment? And even out of something as simple as that, there was some good discussion that came up. Or where does everyone get their meat from in Southeast Queensland? Or where, there's all different topics that come up. And so, how do people express gratitude on a daily level? What do you do when you start reacting to something? And so the discussions are very helpful because, again, as Emma mentioned, you realize you're not alone, and that others are experiencing similar things, and there are strategies. So I guess one of the traps you could say is discouragement when you're on the road to healing through holistic health. And I think being on this type of program helps with countering discouragement, in that you feel like you're part of a community who's doing it together. So, yeah. So if you are dealing with a chronic health problem and you're needing more support, this could be something to consider, one of these programs. And you can find out more by contacting reception at our clinic, and then usually you'll fill out a new patient inquiry form online, and then we'll get back to you with which of the monthly programs we recommend. So that's the general route. Maybe we can just put our contact details in the chat pane for people, so they know how to contact us. But yeah, generally it's around $450 a month for the rose, $580 a month for the gold, and the diamond is $750 a month. So it's a minimum of 6-month commitment. So there's a little bit of a cost there, but I guess you could say the message here is also realizing that there is a certain amount of investment. I would say the bigger investment in some ways is the investment of energy that you need to make if you're going to get well. You need to realize there's a certain investment. It's not a quick fix if you're dealing with one of these chronic illnesses that's related to something like mold or tick-borne infections or mast cell activation, heavy metals, etc. We do have a slightly different program for cancer, which we'll be talking about at a later webinar. Did you want to talk a little bit about longevity? I'm about talked out here.
So we started the longevity program, reasonably recently, and it's going well so far. So the first phase is the discovery program. So the cost of that one is $19.80, and it includes, there's a biological aging test that Sandeep mentioned earlier. So our biological age being different to our chronological age often. So chronological age being the age that we are now, biological age is how well our system is aging. And so there's also blood tests, urine tests with QML, NAD testing, which is that test of cellular health, and hair mineral analysis, which gives you some information about the minerals in the body and also whether you've got what heavy metals. And so that then gets combined into a treatment protocol, which might involve diet, might involve supplements, detoxification, and other things. And the aim of all that being to reduce your biological age. So we're trying to get the biological age significantly down below our chronological age, so that when you're, for example, 80, you've got the biological age of a 65-year-old, and you can still travel around the world and play sport and do whatever you want to do. So the aim is to keep us disease-free and healthy for as long as possible, rather than having this kind of slow decline over time that most people have, where we get a chronic disease and then maybe another one, and we get this slow decline of health. So we're trying to avoid that and stay healthy well into our older age. So the main package we've got is this longevity full package. So we've got 40 minutes every 3 months of doctor consults, 1 hour of health coaching per month, and there's some testing included there. And there's also that discount on supplements as well. And then you can see there's a couple of other options there that just have slightly less inclusions in them as you go down.
Yeah. So if you guys wanted to find out more about this, you can book in a discovery call with Jacqui, and we can go ahead and also put a link on that in the chat. Yep. And it's a little bit slim pickings getting in with Jacqui at the moment, but there are still a few slots there. And she in those sessions, they're free sessions, to just talk about how how it all works and whether you're a suitable candidate or not. So you do need to have a certain amount of commitment and energy to put to this thing. The other thing to mention is if you're seriously unwell at the moment, like let's say you're right in the throes of mold illness or tick-borne illness, etc., we usually wouldn't say to go on the longevity program there and then. The reason being that, you really just need to focus on dealing with that threat and coming then, and then retraining your nervous system and getting out of the cell danger response and so on. There is still a degree of crossover, and that, some of those practices like, intermittent fasting is one of the big things that we talk about on the longevity program. That can also be very helpful for chronic illness as well. So there's definitely some things that can be crossed over, but I guess we would say that at least you probably need to be out of the more acute phase of chronic illness in order to go on the longevity phase. Otherwise, we'd kind of be distracting you from what you need to be doing. So, that's a little bit about that. So maybe we could pull up this link for the I can pull up the link for the discovery call while we're doing questions and answers.
Sorry.
No, that's okay. So that takes us to questions and answers. So if you do have any questions, please put them in the Q&A pane located in the bottom of the Zoom app, and we'll get to those one by one.
I think we might have to fix the hot doc booking system, but we can do that. The discovery call is not coming up.
Okay. Let's have a look. Okay, if you want to start asking questions, I can probably stop sharing at this point. We can jump into that, and I'll see if I can find this.
There was the Stephen saying, is that 48-year-old female Shelley, the case study? It wasn't, was it?
I'm not going to talk about specific cases or anything like that, but thanks for clarifying.
Maria just says, Emma, you've hit the nail on the head. They're amazing. I could not have got to where I am on my own. Thanks, Maria. That's lovely. Beatrice says,
that's interesting. Thank you for that, Maria. I'd be interested to know which part, if you wanted to comment further, which part did you find the most helpful? And was there any particular changes or improvements you'd make to it, or did you find it to all be really good? And why aren't you on it at the moment? Next question.
No, just pop your hand up, Maria, if you want to jump in. Beatrice is saying, hi, would you be able to treat fluoroquinolone toxicity?
Hang on just one sec. I've just found the link, so I'm just going to put that in, and then I'll jump back to that. We're multitasking here like anything.
Yeah.
Okay. To everyone. Okay.
Oh, thank you.
I think that's correct. Okay, sorry, just repeat the question.
Would you be able to treat fluoroquinolone toxicity? You just wanted me to say that again.
Yeah, well, see, that was part of my problem. So the antibiotic, I mentioned about the antibiotic that I had, it was a fluoroquinolone. So there is there's an additional piece to it there, that not only does it muck up the gut flora and cause leaky gut, but it also causes major cellular problems. And so it gets in the way of cell energy production. And so there is a number of different things that can be used there to try and restore cellular health, the PQQ and various other things, but it has to be done in the right order. So, yeah, I think that's definitely within our scope. And I think, I think fluoroquinolone toxicity is an under-recognized problem. And they're used a lot in America, particularly, those antibiotics. So, yeah.
Jenny's asking, I know that the program's for a 6-month period. What happens after that time elapses?
Yeah, so that's a great question. So there's no pressure, but generally speaking, if you think about Emma's story, really, it's not really just 6 months. I mean, I guess you could say the 6 months is for practicality and so on. But generally speaking, we're recommending doing around 18 months on the program. So what happens is the renewal programs are slightly cheaper because you don't have to go through that initial discovery phase. Where you're having that really, really long consultation and the reason for that really long consultation is we do ART testing, which is autonomic response testing, and take a very thorough history, and we work out what many of your hidden infections and toxins are and so on. So that really only needs to happen once. So the renewal programs then are significantly less because you don't have to do that whole phase. And the next phase, like the second 6 months, we often start to shift focus a little bit just from mold and mast cell, etc., to start also working a little bit more with gut health. So there's some different tests included. So you generally, like for instance, if you're doing the diamond, you get the full microbiome mapping involved, and so in general, some people then drop down to the slightly lower level because just depending on how you're going with your implementation of the strategies given by the health coach, you may find that you then reach a level where you don't need one every month. You might just need a health coaching session every 2 months. So therefore, you might then drop from the gold program down to the rose program, which is significantly more affordable. And then you're still kind of utilizing the community support, but it's almost like your training wheels come off a little bit at that point, and you're not having to rely on Jacqui quite as much to just get those basics going in your lifestyle. So yeah, so generally you can just go downwards. So if people start with diamond, they often then drop down to the gold. The diamond is for people who need quite a lot of medical support initially, and perhaps they haven't been fully sorted out with a proper diagnosis, etc. And then after that you often go onto the gold package, which is then a lot more health coaching and less medical support, and then you might drop down to the rose package, which is less health coaching, but still 3 sessions for the 6 months, which is still quite good, and 2 doctor sessions. So yep, you might, I would still say that you should plan to really be on it for around 18 months, because that's usually around the period of time where you really can turn things around in terms of your illness. Thank you for the question.
Maria says, I'm definitely online. Dr. Gupta mentioned he had mold and mercury. Can you detox the mold and heavy metals at the same time?
Yeah, you can. It seems that the mold actually blocks the other the detoxification pathways for heavy metals to a certain degree. So, if you're doing the detoxification procedures, well, we don't know for sure which order it all comes out, but it does seem to all come out gradually. And but in general, it would be more that the mold, that you focus on the mold to start with, and then the mercury, it comes later. But, there's always crossover, and some of the binders for mycotoxins will also bind mercury, so particularly like the zeolite, will help, and often we do have people on a little bit of chlorella and cilantro as we go along. So look, it's very individual. And the other big thing which is underrated is just getting your diet right, and getting your nervous system in a better place. All of that helps your cells, so that your cells start to then let go of toxins a lot easier automatically. It's not all about specific detoxification procedures. A lot of it is just about bringing in better nutrition and better nervous system health. That already starts the process of detoxification.
Sounds good, thank you. Maria has jumped in with a comment. I was helped in so many ways, especially gut issues. using supplements and calming down MCAS. I was having issues sleeping, and in 2023, having Anna on a monthly basis, who is our other health coach, helped me to calm down, and doing grounding, etc. Also doing the brain retraining with Ashok Gupta, I think that must be, was also very helpful. Thanks for that, Maria. Lovely comments.
Yeah, that's great feedback as well. So look, we do feel that the programs you've set up, we have refined them to some degree, and we're always still looking for feedback. So if there's anything that you find, perhaps could be done slightly different, we're always open to that. Everyone's individual, so we try not to make it too regimented. Like, so for instance, if you find that, you signed up for a program where you have 6 health coaching, but you find you only need 3 or 4, then we can swap things around a little bit. Like if you need a bit more medical support, we could swap a few health coaching for a doctor consult, or switch over to do some emotional healing with one of our emotional practitioners, for instance. So, we're always aware that everyone has unique needs, and we're keeping that in mind. So, yeah, I do hope that you consider coming along and joining us with one of our monthly programs. So yeah, thanks very much, Jacqui, for coming along, and Emma, if you're still there. And thank you everyone for joining us, and have a great rest of the evening.
Thanks everyone.
Bye.